Welcome, friends, to the new Total Health channel, which will also be featuring The Bridegroom Comes for a podcast. And please stay with us, like this, share it with your friends. I think it's high value. Today we'll be sharing health information that can help you live well. I think I've done it well. I'm 81 and in great health, and just like to share how you can do it without prescription drugs. I am an MD. I was board certified in internal medicine and taught health science at Loma Linda University. And during that time, I had some eye-opening experiences. The dean, who was really the most educated man that I've ever known, three doctor's degrees. He was an MD and taught anatomy. Did so well at teaching that when they needed a chairman of the Department of Pharmacology, they asked him, and he took pharmacology, got a PhD in Stanford University, and was chairman of the department for years when I was a medical student. But at that point, they wanted to start a school of public health, and he went to Harvard, got his doctor of public health degree, came back to be dean of the school, and he encouraged me when an opportunity to go to Africa as a missionary did not work out. He encouraged me to take internal medicine, cardiology, come back and teach, which I did. And it was an interesting experience. I did executive health, and I'll tell you about it a little bit more later. But while I was there teaching, he came to me, this was the mid-'70s, and he said, they're starting to call medical care health care. Like, how could they do that? He knew that drugs are not health care, not healthy. In fact, he shared with me a key statement that I want to share with you. This is from Drill's textbook of pharmacology. And in it, he says that, the textbook for pharmacology, chapter 5, Mechanisms of Drug Action, it says that drug action always represents artificial interference with the natural functioning of the organism. In the widest sense of the word, every drug is by definition a poison. Pharmacology and toxicology are one. They're the same thing. And the art of medicine is to use these poisons beneficially. Well, can you figure out that oxymoron? How can that be so? Well, if your blood pressure is sky high and you're about to blow a blood vessel in your brain to get a stroke, yeah, take a drug and get it down. But I could share with you half a dozen ways that you can, by lifestyle, help your blood pressure. It was in the mid-'70s while I was at the school that I attended some cardiology meetings in Anaheim, across from Disneyland, and Pritikin was reporting on his results of diet and exercise. He hired doctors to work with him, and 85% of the patients that he had who had high blood pressure at the end of a month no longer needed their medication if they ate a low-fat, low-salt diet, no caffeine or alcohol, and got some exercise. Okay, because the fat and oil makes the blood sticky in your blood, and when it's sticky, you need more pressure to push it around the circulation. So, another doctor, and I'm blocking on his name right now, Neil Barnard, thought that many people think that when they're diabetic that the cause is too much sugar. Well, really, he said it's the oils and fats that block the insulin receptors. And on a low-fat diet, type 2 diabetics do not need drugs. Their blood pressure, their blood sugar is fine. It's type 1, they may still need it, but I had a nurse who helped me with some of my health programming. She was a type 1 diabetic. She got a kidney from her sister, transplant, and she was taking 80 units a day, but reduced from 80 units to 18 units a day on a low-fat diet and walking as exercise. So, hey, you can do that, I believe, get along with less, and you'll be better off for the most part. So, medical care is not health care. It's a leading cause of illness and death. I will quote the medical literature for you, and basically the medical literature in the Journal of American Medical Association in April 15, 1998, reported 106,000 deaths in hospitals, and they called it an adverse drug reaction. The definition of that is it's not an overdose and it's not a bad prescription. It's the appropriate prescription. Person took it appropriately prescribed in amounts, but the person has a reaction some way. And so that's huge for 106,000 deaths. And 2 years later, that was in hospitals. 2 years later, it was outpatients. The Western Journal of Medicine on June of 2000 reported 199,000 deaths as people not in the hospital. Well, most of them are not in the hospital when they died. And also many illnesses as a result. I forget how many, but it was huge. And so that made enough. 106 and 199 make 305,000. Medical care was number 3 cause of death at that time, second only to, third to cancer, and heart disease is number 1. Well, in 2007, a 7-year study was reported from 1998 to 2005, and they said that the death rate increased 2.7-fold and other adverse reactions 2.6-fold. So you multiply 305,000 by 2.7 and you get 824,000 deaths. And guess what? Drugs are the leading cause of death. It's not heart disease. The CDC is lying to you. They get money from their recommendations for vaccinations and shots. They're in bed with the pharma industry, and they don't want to jeopardize that. They don't report on medical care as a cause of death. They want it as lucrative as they can make it, and so get your drugs for your heart, get your drugs for your blood pressure, get your drugs for your diabetes, cholesterol, etc. ad nauseum, okay? Because they are liars, and the medical literature proves it. It's just that most people don't read medical literature. Even doctors are too busy usually to read their journals. So overall, bad situation for this country, and the ads on the TV are not telling the truth. They give you a little hint by if you have this problem or that. If you're pregnant, tell your doctor whatever. It's not good. And I'm will be giving you as a gift later on a link to a video online. Cleveland Clinic's cardiologist Dr. Esselstyn tells how most diseases are reversible on a low-fat diet that's plant-based, vegan type of diet. And that's also how Dr. Colin Campbell, head of nutrition from Cornell, he collaborated with Oxford University and the China study. And he summarizes the China study in 4 words: plant-based, whole foods. Okay. And if you do that, I've done that most of my life, and I will tell you, you can eat well, and I enjoy food just as much as the next person, but I wouldn't mind gaining a few more muscles, but I'm not busy. If I were throwing bales of hay on a farm, I would get the muscles. The body is conservative. If sitting here behind a desk, I don't need the muscle, but anyway, I'm not overweight, I'll tell you that. So I would just say I'm going to share with you the tips and the helps to a better health care, and it really comes from, I would say, an acronym, New Start. N is for nutrition, and it's not what we were taught as kids, but really, if you were to go to the Bible and read the first few pages, it's plant-based. The fruits of the tree, the whole grains, the nuts, and vegetables, the herb of the field. And when we're talking about vegetables, the green leafy and the yellow vegetables are especially good because they're high in vitamin A, which is good for your skin and good for a lot of things in your body. So that's nutrition, in a nutshell. By the way, the word nut, N-U-T, is the first three letters of nutrition. And I like nuts. A handful of nuts is actually protective in ways that science is still learning about. So, but don't overdo it. You can especially when you make it into a nut butter, peanut butter, spread it on thick and put on jelly or something. It's very tasty, but I ate so much of it that I got headaches when I was teaching at Loma Linda University in the School of Health, Public Health. I had a executive. I did the executive physicals, and one executive said that sugar bothers joints, and another said that cheese made his joints ache, and a third one said meat gave him arthritis. Well, these were smart men that had figured it out, but I couldn't figure it out when I got headaches. I couldn't see a relationship between what I ate and my headaches. So I went across the campus to the medical school and talked to a neurologist who taught medical students. And I asked, "Is anything I eat or drink be the cause of my headaches?" He shook his head and said, "That would be very rare for my kind of headache." I had tension headaches. They were not migraine. Migraines are often linked to hormones or some food maybe. But my headaches, he said, no, couldn't see a relationship. Well, I later learned he didn't know. When I left Loma Linda, I went into practice with 5 other doctors, and one was an allergist, and people drove hundreds of miles to see him. The parking lot was filled for this guy, and one day I said, "How many people with headaches can you help?" He said, "Oh, about 9 out of 10. I said, "Test me." And he did a blood test and told me that I had a problem with wheat, gluten, peanut butter, oats. Well, I was overdoing the granolas and the whole wheat sandwiches. When I was at the university, I would take 2 sandwiches a day. If I didn't feel filled up if I didn't get 2 sandwiches, Monday to Friday. But on the weekend, my wife would say, "Oh, you get bread every day. We're getting fresh fruits, vegetables, other things." And Sunday was oat waffles, but it wasn't toast. It wasn't. And I was going through withdrawal. I didn't know that, but every Monday morning, headache. Couldn't figure it out. You think, well, this guy hates his job. No, I like my job, really. But I couldn't see why, after exercise and having a good, healthy day, that I would wake up, but it was working it out of my body. When people smoke, they don't get sick. They get sick when they don't smoke. If they try to quit, they go through withdrawal. And that's the way my headaches were. And they might be why your joints ache sometimes, or why this, that, or some other symptom can be related to foods, basically. So if you have a favorite food that you just think you gotta have, I had a patient who was hypoglycemic, and I gotta have my tiger milk. Well, that was number one suspect, because when you think you have to have something, it shouldn't be that way. Food should not give us a high, because what goes up comes down, crash, and we feel bad later, you see. So food should be enjoyable, tasty, we love it, but we shouldn't be affected one way or the other, up or down. Well, that's probably enough talking about nutrition. The acronym we're talking about is New Start, nutrition for N, and N for nutrition, E for exercise. And I just saw an article yesterday, a new hobby that you should take up if you want to live to be 100. Guess what that is? Gardening. Well, I think so, maybe. Gardening is a good exercise. It's practical. Psychologically, you're getting benefit from what you're doing. And with what's happening in the stores, they might not always have your favorite vegetables, or there's sprays, there's poisons, GMO modification, and so on. Eat organic if you can, but learn to garden. That was the original lesson book in the Bible, Genesis. God put Adam and Eve in a garden. Well, they did it wrong and then were thrown out of the garden. But we can. One of the curses of their fall and sin is that in the sweat of your brow you earn bread. So let's sweat a little bit. Sweat gets rid of some poisons and toxins as well, and we can do that. So here we are. N for nutrition, E for exercise. And by the way, I should say that walking is one of the best forms of exercise. As long as you live, you're going to want to walk to the bathroom. Okay, it's trouble when you can't or don't. And I took up stair climbing. When I was in New York for a while, there was a building 40 flights. I could go up in 5 minutes, 2 steps at a time. I still can go upstairs 2 steps at a time. I just don't go 40 flights here in Arizona. Can't find them anywhere close. But I would say do the exercise, and it helps you metabolize your food much better. And chew it well, and don't be in a hurry. Too often we eat too much too late in the day, which is a weight problem. If actually 2 meals a day would help most people better to weight control. If you eat a good breakfast and a good early afternoon or mid-afternoon meal, and skip the evening night meal. I've done that for most of my life, and it has proven well worthwhile with no weight problems in terms of the upper side. I would like to be a little more muscular and so on, but that's okay. I don't do enough work to earn it. Okay, so thank you for these considerations. Now, nutrition, exercise, and water. We don't get enough water. Water helps the kidneys. The kidneys purify the blood, and we got some impurities as a result, just naturally. But drink enough so that your urine can not be yellow, but maybe a pale lemonade color, and that is a good rule of thumb. And water, don't. Sometimes people think they need hard water with calcium in it, but hard water can get in your joints and plug up your arteries with cholesterol. Hardening of the arteries comes from calcium embedded in the cholesterol. So soft water is really better, but not commercially softened with sodium. The water softeners that they make for homes where you exchange salt for calcium is not good. But rainwater, for example, that's distilled water. Distilled water is good. If it doesn't have the calcium in it, and drink that is helpful. You don't need to get your minerals from water. Get your minerals from the green leafy vegetables. Dark green leaves are high in calcium and protein and other things that we need. So that's NEW, nutrition, exercise, water, and then new start. S for sunlight. Sunshine is the vitamin D sunlight vitamin, and it helps women with breast cancer to avoid metastases or spread. Vitamin D makes bones harder, and the spread of cancer can't happen as easily. So they've noticed this, people that have sunlight. And another thing with sunlight is the seasonal affective disorder. People living in the Northeast where they don't have a blue sky, they have gray every day, sunlight is cut out, they feel depressed. Okay, well, I would too if I lived there. I'm enjoying beautiful blue sky as I look out the window. It's nice. So think on these things and make the changes, because Breslow, Dean of UCLA, found that 7 simple health habits, like we're talking about, were good for a 11-year advantage as an average, but 30-year advantage if you follow it completely. With, in other words, all 7 rules, you have a 30-year advantage compared to the people who break all 7. And the big 3 were smoking, drinking, and obesity. We can easily recognize those might be trouble. But exercise and sleep, it'd be nice if we could get 7 or 8 hours sleep every night. If you don't get it, why, take a nap before supper or something like that. But eat a light supper. Don't eat a heavy supper. And be busy afterwards. Get some exercise, go for a walk. Help your digestion before you sleep. Because if you have a high-fat diet, your blood is sticky and going through the tiny blood vessels, you can get many strokes and not even know it. It's only when a big blood vessel gets blocked that, oh, I can't move my arm, or I can't talk, or something. But the idea is good, vigorous exercise helps the blood to be vigorous and not to form little tiny blood clots in little capillaries and so on. So let's think on that. And sunlight temperance. Temperance would, in my opinion, would define as avoiding harmful things like alcohol, tobacco, drugs, and prescription drugs, over-the-counter drugs, all of those, and then get well, I lost my train of thought. We want to avoid the drugs and get balance in everything else, not excessive. We can overdo even good food, you see. And then after T for temperance, A for air, pure air, quit smoking. And by the way, if you drink coffee or caffeine, it's almost impossible to quit smoking because caffeine drives your nerves up and nicotine in the tobacco drives them down, and they keep you in balance. If you try to quit smoking and you're drinking coffee, your nerves go out the roof. You can't quit, hardly. It's very difficult. Well, I had a mayor in a little town of Southwest City, Missouri, who said, "Doc, I've tried many times, but this is the easiest way I found it." And it includes quitting other bad habits at the time. Don't use alcohol. Don't use caffeine. Get exercise. Drink some water when you're tempted to smoke, etc. Call a buddy system. And you can do it. Tough through the 5 days. You'll feel lousy for 5, but on the 5th night when we did a stop smoking program at the University of Arizona in Tucson, we had 150 people in the course, and on the last night we asked how many people have not smoked in the previous 24 hours, and about 100 raised their hands. 2/3 of them had been successful in those 5 days because they said we're going to make it, because they had had 1 day without any smokes, and it was the craving was waning. It was getting less. Okay, they had been through withdrawal. So you can do that, and I just want to encourage you, make a serious effort, because bad times are coming, and you might not be able to afford your tobacco or this or that and go through misery. And God wants us, our body is His temple. We want it to be good for Him, and His Word has clues, little tips for better living, so that we can live well even without a doctor. And I'm a doctor, but I don't want to see you sick, and I'm not telling you to come back in a month for blood tests or prescriptions and so on. So overall, what we put in our mouth is a key to physical health, whether it's smoking, drinking, or foods. And what we put in our eyes or ears, our senses, goes to our brain, and we have happy attitudes if we get good information. If we think that the love story we see late at night is true love, we're going to be unhappy. And but happiness is a result of wise choices of what we watch. Stay away from the fiction. That's baloney. Okay, we don't need fiction. And so mouth is the pathway for physical health, eyes and ears for mental health, and the brain, or rather the heart, for destiny. If we appreciate God, the Creator, and we want to live well for Him and obey His laws, we have a better destiny than if we want to just do our own thing and screw everybody else. Okay, that's not the way to do it. How we treat others is how God considers. Christ said, "Inasmuch as you've done it to the least of these, you've done it to me." And by the way, while I'm talking about this, let me appeal to you, because I didn't think the world was going to last this long, and when I worked emergency room, I did not always pay into Social Security. I only get $1,021 a month, and I really can't afford the $1,500 a month for these programs unless you folk kick in and donate to this program, or buy my books. Go on Amazon. My name, Ruhling, spelled R-U-H-L-I-N-G. I don't know if you can see that. Like, this is a book, The Bridegroom Comes. That's the name of a series we will be doing, and I have other books as well. This is a health book, Health, Happiness, and Destiny Come from Wise Choices. And so go to Amazon, take a look at it, or my website, Health, Happiness, Destiny, and it will help you to know how to live better. So I thank you for listening to this. Please like and share this with others. It's the Wedding Parables will be covering starting next week, and relevant to what's happening in the current news. Thank you for giving that a look. And I would say um, I think you will. Um, I should tell you this: if there's any one substance that could probably help most people with their health, it would be stopping coffee. Caffeine is a high risk for a dozen different things. It's headaches on withdrawal, anxiety if you take too much caffeine, sleep disorders is common, breast lumps for my daughter who couldn't stay awake working the night shift at the hospital. She drank Cokes, caffeine, and cleft palate or hair lip for little babies with chromosomal damage if their mother drank too much coffee early in pregnancy. My drug companies love caffeine and coffee because it creates the need for other things. For example, GERD, gastroesophageal reflux disease. Caffeine weakens the tone of the little sphincter muscle at the top of the stomach. It turns on acid big time, so you get gastritis and peptic ulcers. The New England Journal of Medicine, in 1981, lead article on March 12, reported coffee and cancer of the pancreas. Strong association with 369 patients with proven cancer. Not smoking, not drinking, but caffeine, coffee, causing the cancer, apparently, in a high association. And women drinking coffee get osteoporosis, bladder cancer, 2 cups of coffee for women in a Harvard newsletter, etc. So please consider these things and drop coffee out as well, and you'll be better off. And now I'm going to try to see a little falling out. Here we go. Listen to this. Here we go.